Hello everyone. Today we are going to discuss child psychology. Child psychology word is made up of two words, child and psychology. The word psychology is again made up of two words, psych and logos. Psych means mind, logos means study. So study of mind is known as psychology. Child is defined as a person of either sex between the age of birth till adolescence. Child is defined as a person of either sex, either male or female, between the time he or she is born till he becomes young or adolescent. So child is defined as a person of either sex between the time of birth and adolescence. And psych means mind, logos means study. So study of mind in a child is known as child psychology. Or study of mind in a person of either sex between the age of birth till adolescence is known as child psychology. Definition: it is defined as a science that deals with the mental power or an interaction between the conscious and subconscious element in the child. It is defined as a science that deals with the mental power or an interaction between the conscious and subconscious element in the child. Now, what is conscious and subconscious interaction? If whatever you are thinking right now and what is running in your brain, which is under control, is conscious, you are looking at this presentation, this is conscious. For example, a child may come to an operatory or a clinic. We say open the mouth. So this is conscious because he knows what he is doing. But inside his mind, one thought must be coming in his mind that what dentist is going to do with my oral cavity and what instruments he will use in my oral cavity. When you understand this interaction, this is subconscious or unconscious. So you have to understand the interaction between conscious and subconscious element so that you can understand the behavior of the child. This is child psychology. So now what is the need of studying psychology? There's a very famous quote which says that body does what mind says. Body does what mind says. And what body does is known as behavior. So what is a behavior? Behavior is an observational act. In simple words, behavior is something which can be observed with the second person. I'm standing in front of you, you're watching me, so that's my behavior. You're sitting, I can observe you, your behavior. Somebody is dancing, singing or sitting, and if the second person can observe the person, it is known as the behavior. It is simply means observational act. So if you look at this quote again, body does what mind says. What body does is known as behavior. And if you see this, I said body does what mind says, that means mind controls the behavior. Because what body does is behavior and mind controls the behavior. That means if you have to manage the child behavior, you have to understand the mind first. And the study of mind is known as psychology. That is what is the need of studying psychology before you understand or before you modify the behavior of the child in the dental operatory. Now coming to the importance of child psychology. You can remember by this mnemonic, UP के DC के पास TC है. UP के DC के पास TC है. U stand for understanding the child better. If you know, the reason of studying psychology is you can understand the child better. P stand for problem of psychological origin. You can understand the problem of any psychological origin if the child has, if you know the psychology. D stand for delivering dental services in meaningful and effective manner. Delivering dental services in meaningful and effective manner. C stand for communication. To establish an effective communication with the child, you need to understand psychology. P stand for plan out an effective treatment plan. You need to understand psychology. C stand for confidence of the child. To gain the confidence of the child, you need to understand psychology so that you can, give a positive dental attitude to the child. Then T stand for teaching the importance of primary health services and importance of first visit and the preventive health services. You need to understand psychology. And then C stand for giving a comfortable environment for both the dentist and the patient to work together. You need to understand psychology. So the importance of psychology, you can remember this mnemonic. UP के DC के पास TC है. U stand for understanding the child better. P stand for to understand the problem of psychological origin. D stand for delivering dental services in meaningful and effective manner. C stand for communication, to gain a good, effective, establish a communication with the child. P stand for plan out the treatment plan. C stand for gaining the confidence of the child so that you can instill a positive dental attitude. T stand for to teach the importance of preventive health services and importance of first oral health visit. And then C stand for giving comfortable environment for both the dentist and the patient to work together. Now coming to the theories of child psychology, we have two categories. First is psychodynamic, second is behavior learning theories. Psychodynamic theories, we have three psychodynamic theories: psychosexual theory, psychosocial theory and cognitive theory. Behavior learning theories, we have four: social learning theory, operant conditioning theory, classical conditioning theory and hierarchy of needs. So we have two categories: psychodynamic theories and behavior learning theories. Psychodynamic, we have three: psychosexual theory given by Sigmund Freud 1905, psychosocial theory. Psychosocial, psych means mind, social means society. According to Ike Erikson, it is not a sexual fantasy, it is the society which grows the mind. Cognition means self-thinking. Jean Piaget said that it is neither a sexual fantasy, it is not the society, it is the self-thinking which grows the mind. Mind grows by itself. That is the basis of cognitive theory by Jean Piaget. We'll be discussing all these theories in detail in the later classes. So behavior learning theories and psychodynamic theories, we have two categories here.